So welcome to this edition of Menopause Conversations. I'm delighted to have a colleague. I think we can call ourselves colleagues, can't we, Pamela? Because we do similar sort of things, but different also. I'd like you to give a warm welcome to my wonderful colleague Pamela Windle, who is a guest on our podcast today, because we're gonna talk about some interesting things. We're going to actually be a little bit controversial. Why not? But let me tell you a little bit about Pamela, and then I'm going to invite her to tell you a lot more about herself. So Pamela is actually an integrated women's health specialist. Now, that in itself deserves a round of applause, because it sounds like she knows a lot of stuff, and believe me, she does know a lot of stuff. And she's also a women's health in the workplace consultant, and she advises on various things. Most recently, I believe, the British Standard Institute, BS30416. There you go, it just trips off the tongue, which is all about menstruation, menstrual health, and menopause in the workplace. So, Pamela, welcome. Lovely to have you on.
Wow, thank you so much. Thank you so much, Sandra, for that lovely introduction. I mean, goodness me, I would say that we are colleagues for sure. And this is a big space, isn't it, for many women or people to be involved in as well. So yes, so thank you for inviting me to be a guest on your podcast.
No, that's brilliant. It's brilliant. And even that, there's something in that narrative, isn't there, that actually, we can't be colleagues, we can't be, on the same page, on the same platform. There's a whole load of that goes on, isn't there? But actually, I think what I tend to find, you tell me if you disagree, Pamela, is that actually, if you have the right values, you attract the right people.
Absolutely, 100%. I totally agree. I mean, actually, because I met you online, and then I met you at the BSI event earlier this year. And as soon as I saw you, I was like, oh my gosh, there's that face from social media, from LinkedIn, and I just instantly connected with you. And you're absolutely right. There are millions of women that need help in the workplace. And so therefore, why can't we become colleagues?
Exactly. I totally agree. I totally agree. If we're serious about the business of menopause, serious about keeping women in work, then we're stronger together. We'll go further together, won't we? I love a massive dose of collaboration in my life. So this is great. So yes, when we had that hug at the British Standards Institute, I mean we were a bit giddy, and it was like, because it does feel a bit weird. We're going to talk about the social media in a bit, but tell us a little bit more about what you do, if you don't mind, for people watching this. What is it you actually do on a day-to-day basis?
Yeah, so I've been working with women in that perimenopause, menopause journey for the last 8 years. And what I do, so when we talk about integrative, I have many tools that I help women. So from functional nutrition, making sure actually the food that they're eating is right for their bodies. And, as we're going to touch on social media, there's this blanket approach, isn't it? Everybody needs to eat a certain way. And if you don't, then, you're doing something wrong. Well, actually, for some women, certain foods might be an irritant to them. Certain supplements might not suit their bodies. So I really look at a woman, like her personal health care. I am her personal health care practitioner. And that could be from the food that she puts on a fork every day, to the supplements she takes in, to the symptoms that she's experiencing, maybe things that affected her as a child, or even far back as her mother. What was her mother's health when she was conceiving you? What traumas and stresses did she experience? And then, childhood, what was your childhood like? What did you eat as a child? Did you have medication as a child? Did you have childhood illnesses or allergies, all those sort of things? And then what happened to you as a teenager? What was your period like? When did you start that? What challenges did you face as a young woman? And then what other losses have you faced as a woman growing up, and to be to where you are now today? So I look at you holistically and broadly, but then, what are your limited beliefs about yourself? Often we get to our age and, we're carrying a lot of baggage, and often they can start from really early on from childhood, from school, parents, have a big, strong influence on you. And so we can have those limited beliefs about ourselves that actually in the perimenopause transition can start to arise. And you might have not even thought about it years ago, and you might be struggling with sleep, but it could be something as simple as a belief about being alone, for example, that stems from being a child. And then the other things I do diagnostic testing. So the Dutch test, which is a hormonal test, stool testing, and other tests like mineral deficiencies and sort of neurotransmitters. And I'm a bit of a geek, so I love looking at data. And I also look at your blood sugar levels as well. So a lot of things that I do with women. And I talk about so many things like pelvic floor health, your posture, because my background is a physical trainer as well as a personal trainer. So I talk about a lot of things when it comes to women's health.
It's amazing, and I love that, because does seem to me, here's the first contentious thing I'm going to say, it does seem to be like the minute we say menopause and it just like slap on a generic approach. And you and I both know, because of the client base that we have and the people that we're seeing, that so many people are carrying stories either given to them from the past or experiences that they've had, which are showing up in their body and in their mind, aren't they? And this itself is an integrated system. You can't have one without the other. So it makes sense. It makes complete sense to me, because that's the similarity of how I work with people. I'm not a functional nutritionist, but I advocate all of these things, and I signpost people to people like you, so that they can connect more of the dots. I'm much more the neurological side of things, figuring out the patterning that you're carrying, the stories, the limiting beliefs, all of those sorts of things. But to have it all together is fabulous. So, and even before we came on, we sort of, what it's like when you join a call. What's Pamela doing? She's looking at someone's glucose app and their levels and stuff, because like you, I would be doing that sort of stuff, because it informs how you help people, doesn't it?
Yeah, 100%. And not only just it just inform myself, but it gives them motivation.
Yeah.
My clients feel motivated. They can see what's happening. They might not feel the consequences in terms of blood sugar, this thing I've just eaten 2 hours ago, or at night I might be having a hypo, but I'm sleeping through the night. But actually, if you continue to do that, have these spikes and lows, then you are moving to ill health. It might not be next month, but certainly within the next year or so, you're on a fast track to conditions that affect women, particularly Afro-Caribbean and Southeast Asian women, like heart disease and type 2 diabetes, that is more prevalent amongst our cultures. So it's really motivating as well for clients as well to see that thing that's happening, that's silent almost, that actually has such a dramatic effect on their bodies.
Absolutely. So that's so helpful to know. So let's talk about some of these beliefs and narratives, shall we? Because when we both met, I whispered in your ear and I said to you, I think we need to do a podcast about this, because some of the narratives that, as women of colour, I'm happy with that phrase. Are you happy with that phrase? Or as a black woman, I'm a brown woman, sharing, literally a brown woman. I just don't feel the narratives are helpful to me that we are swashing around in. What do you think? What do you think, Pamela? Do you think all the narratives are helpful? Do they help people like us?
I personally, I have a really strong opinion about this, actually.
Let's have it.
Really do. And every time I see this referenced on social media, I feel so angry, because I'm like, where is this information from? So obviously we're talking about the Swan Report, aren't we, here?
Yeah. So the Swan, tell people about the Swan Report, because you do it so well.
So the Swan Report is over 2 decades old originally. over 2 decades old, and they the study in itself is a good study, but it's an American study, and it's meant to be across the nation, but actually it is across the nation, but in America.
Yeah.
Everybody lived in America.
Yeah, of course they do.
So, Hispanics, Caucasian, and African Americans were in the study. And they did, it was urine samples, and I think there might have been some other tests that they did, but mostly it was urine. So what they identified from the study was that, African Americans and Hispanic women generally entered menopause a lot earlier than their white counterparts. And for African Americans, they had worse symptoms such as hot flushes, lasted longer and worse. And the other thing about the study is that all the participants actually were from a really low economic part of America. So obviously in America, if you're poor, particularly 20 years ago, and it's probably not much different now. Obviously, I can't really comment on that because I'm not American, but from what I see, if you are poor in America, you are poor.
Yes, you don't have access to healthcare systems, social mobility, any of these things that might improve your healthcare. You tend not to have access to them.
Exactly. So is very different to here. And America has got its own history when it comes to racism, like, on another scale. And so for somebody like me, whose parents were, my ancestors are African, so my parents and their mothers and fathers lived in Jamaica. So they came from Jamaica and settled here in the UK in the 1960s.
Yeah.
And so for America, they were taken from Africa to America and withstand a lot of just awful, treatment through the slave trade, and then after that as well. And, racism in America is very, very overtly different to the UK. So the challenges are very different. And so that's this blanket approach. So I think the actual study has been peer reviewed since then, but it's still the same study. It's still the same study. Doesn't matter if you peer reviewed it, it's still the same study, it's still the same participants. So you can't translate that to the UK population. It doesn't work. Our lifestyle, things that we experience are very, very different. And does that say that then all Black women experience this?
Yes. So it's not updated, is it? And it's not culturally relevant to the society that we are living and existing in, because and tell people what's the problem with that. The Swan report is been used, parts of that information are used to advise people through official organizations around how we should be addressing menopause in our cultural microcosms, if you like. So in the margins of society and in those intersectionalities, it's sort of advising that we treat people in a certain way, and you and I don't think it's very helpful.
No, I mean, there was an article that I read that said, Black and Asian women are going to be left behind if they don't take HRT, based on this study. Now, for particularly for Black women, one, they don't sign up for research.
No. Well, they more often than not don't get offered the opportunity, do they?
Well, exactly. So I mean, I saw that research on an article recently that actually switched the wording. So instead of saying African American, it said Afro-Caribbean and Hispanic women. Yeah. And I thought, why would you change that? Because we know the study's American. Now that alludes that actually the study is British, because we're African Caribbean in Britain. Yeah. And it's like, this is public information. Why would you change that? What are you trying to do here? You know, you're trying to say that we've actually studied women of African Caribbean descent here in the UK, and this is what we are experiencing. You know, I've got 8 years of working with women. I've had many Black women that I've worked with, and it's a really small proportion of women who actually enter menopause earlier. It's a really small proportion. And in terms of worst symptoms, what are we talking about? You know, when we talk about the symptoms of the menopause, what's worse?
Well, that's a very personal thing, isn't it?
Exactly. It's subjective.
Yeah.
So how
Exactly.
can we say they have worse symptoms?
And I think that's the problem, isn't it? You said it to me about that the whole menopause conversation has become very reductist, hasn't it? It's like it's been reduced down to here's 3 hormones, 2 of which you might be able to get if you're lucky. 1 you definitely won't in our current health system unless it's a preparation that's actually for men and you're going to have to fiddle around with syringes. But actually, let's just neatly put you all there. So it's come down to you either take HRT or you don't. And that's like saying you wouldn't do that with cancer, would you? You wouldn't do that with diabetes. You wouldn't do that with anything else. But I mean, it's not helpful. We already know that the way menopause has been spoken about, researched about, is largely to the benefit of white women, white middle-aged women. That's not representative of who I am. I'm not a white woman, and I'm not 100% Asian. I'm half Irish and I'm half Sri Lankan. So where do I feature in the data? Because I've got no idea. Are you? And that's what I came up against, Pamela. I was treated as a white woman, and I was gaslighted by the medical industry for more than a decade. You know, I was told, well, you're too young, and you're probably a stressed out mum, because I had a 2-year-old. So no one was actually saying, oh, it's interesting that your mum had fibroids and heavy menstrual bleeding and actually had to have a hysterectomy. It's interesting that your sisters had endometriosis and had to have radical surgery and also a hysterectomy. No one's connecting the dots on our stories. What they're just doing is, oh, it's like you've arrived, right, 1 or 2 choices now for you. And it's like, this is not helpful, is it?
No, not at all. And medical gaslighting is so rife amongst our community. It's certainly the women that I see that come into my clinic. It's shocking, really. And the stories that I hear about GPs not taking them seriously, not even doing the right tests, or saying things that really don't make sense. I mean, judging them, but based on what they look like,
Yes.
there's that notion about black don't crack. You're black, you don't age as fast as Caucasian women do, or people.
Right. Okay.
And so therefore we look younger most of the time. So therefore, they will just take you on face value, as opposed to what I talked to you just before we started filming. A GP looking at my age that had never met me before in person, looking at my age on her screen, and then assuming that I'm a woman of a certain age. Yes, I am a woman of a certain age, but what she didn't realize is that at 57, I'm still perimenopausal, not postmenopause. And so, following my family line, my mom certainly was late 50s. My elder sister, again, around 58. And my middle sister, 53 by the time we reach menopause. So just in my family alone, we enter the menopause much
That's great data, isn't it? Now that's great data. It's not hasn't got that scientific significance yet, but with a few more numbers, that's the sort of thing that would be really helpful. If we come to my family, all 5 years earlier than the average statistic of 51. I was 36, Pamela, when I first got signs of perimenopause. And like you, I'm 15 years into perimenopause. So when I hear these statistics, oh, perimenopause may last between 4 and 12 years, I'm like, not for everybody. So it's almost like, you know, that whole woman of a certain age, they then quickly put you into the stage that they think you should be, rather than actually more questions, more tests, more observation, more connecting the dots with you collaboratively to go, actually, this is really interesting.
Yeah.
That sort of approach would be more helpful to us, wouldn't it?
Yeah, absolutely. I mean, there's some judgment there. A
Yeah.
woman of a certain age, you know, you are a woman of a certain age. Therefore, what do you expect? You are
Mm.
perimenopause. I mean, I hear this from clients, not just from Black clients, but also white clients too. You are a woman. Of course, you're going to be gaining weight. Of course, you're not going to be sleeping. Whether they prescribe or decide to take HRT or not, you know, of course, you're going to feel like this. And there you go. You're a woman of a certain age, and that's it.
So we know, and this is why there are great organisations out there looking to do more data, more clinical research. We've got the Menopause Research and Education Fund. Got people like Dr. Vikram Talalika, Diane Dancebrink, and Fiona Clark, who are really tirelessly campaigning, raising funds to put new robust research in place. But really, it shouldn't take for them to have to do it. We should be doing that nationally, so that we can hold clinicians to account, which is to say, yes, you are following best practice, because right now we're not following best practice. So let's come then on to culturally and social media. Those two things collide amazingly, don't they? Our cultural stories and narratives that we're hearing, but also what's on social media. What do you make of all of that? Is it helpful or is it not helpful?
I mean, so, you know, I've been talking about the menopause since 2016. And so, you know, I started a Facebook group back then. I had my Instagram page and my Facebook page. And I really thought that because I'm a Black woman, that I would attract Black women. I really did. And I remember speaking to my friend who lives in London, who also is Black, probably like 2017, like, where are all the Black women? Like, seriously, where are they? Because why aren't they following me? Why aren't they talking about it, about menopause or perimenopause? You know, my groups are full of Caucasian women, full. I shouldn't let the group go because it was really hard work and
Okay.
overwhelming. just having that much. Yeah, it was just a lot. So I let it go. But where were they? You know, and like culturally, we don't talk about things in public, you know, this sort of thing, it's private. You talk about it amongst your friends at home, and even friends is in some things you don't talk about, but definitely keep it within the family.
Mm-hmm.
So they weren't on social media. You know, if you go into any group on Facebook, menopause group, I guarantee there's just a real small percentage of Black women in those groups that they won't be in those groups at all because they don't air things like that in public.
And would that be about, I mean, what is that about? I don't want to assume. I know what it would be like in Asian communities, but what are the things that are preventing that conversation? Are there fears there? Is there stigma? Is there taboo? Or is it just the cultural norms?
I think there's some taboos around it in
Mm-hmm.
terms of, like, we don't air our things in public. And obviously social media really is public, isn't it? Even though you're,
Mm-hmm.
but so there is that around keeping it in the home or within the family. There may be some, you know, shame around aging as well. But more since, I'd say since, you know, lockdown and the murdering of George Floyd, there seems to be an uprise in terms of Black women now forming groups of Black, you know, safe spaces for Black women to feel comfortable that they can talk about their challenges, that doesn't leave them open to being treated differently, being discriminated by another white person. So smaller groups, more inclusive groups, rather than this like broader group. Because someone told me that they were in a group before lockdown happened, and when George Floyd was murdered, she commented in the group and said, you know, what are other Black women doing here? This is just absolutely awful. This could be my brother, uncle, son, whatever. Yes, it's America, but you know, we all felt it, didn't we?
Massively.
Yeah. And in that group, the owner of that group said, no, we can't talk about that here. This has nothing to do with menopause. Well, so how is that nothing to do with menopause?
Well, it's massively to do with menopause. There's so much of it. You could just plonk that in anywhere, and the whole thing is the stress of life itself that we're all living under, and particularly in the case of what you're just talking about there, it's so important that we do provide a safe space for people to let their stress out, to actually get that validation, to actually get different perspectives, to actually feel better. All of those things massively influence how our hormones operate at any time of our lives, not just menopause, but certainly particularly during that time. So I think it's hugely relevant. So what a shame, what a missed opportunity.
Absolutely. And because she was white, maybe saw it, maybe was affected, but not affected in the same way, because there's this disparity, there's a gap, isn't there? Of course. And I you know, I'm not saying that she was wrong. I'm saying it's wrong for how she responded, but in terms of her, you know, I just think some people just aren't aware.
There's white privilege. There's white privilege, okay, and there is. And
yeah.
there's white male privilege. I mean, the British Menopause Society published a small study, a local council, and white gendered ageism is the #1 thing that stops women progressing in a council. We so know it's not just restricted to a council, don't we? And it's not just white gendered male ageism. I think there is female ageism as well, sadly. And I think one of the narratives that I'm very, very exposed to is not all women are supportive of other women going through the menopause transition. What do you think?
No, not at all. Definitely not. You know, it just brings to mind to a client of mine who her employer, she's Black, didn't want to go on HRT. So, you know, I think there's a real small percentage of Black women that are taking HRT. And so a lot of Black women don't like medication, full stop. So HRT is another medication. And her manager felt that she was being helpful by saying, you know, why don't you take it? You know, really encouraging her to take it. But actually, I feel that could be seen as bullying in some respects, because that actually is none of your business how she chooses to manage her experience. You need to make the right support in the workplace so that she can manage her symptoms well. So what are you doing? What are you doing as an organization? Other than bullying your team member to take HRT when she doesn't want to. That's just adding to it.
Yeah, absolutely. My amazing colleague, June Potts, has done quite a lot of research in this, which is why women don't disclose. And it would be all these reasons, isn't it? Actually, largely people don't want the attention. They don't want the spotlight on them. They just want to come to work. They want to fulfill their potential. They, you know, a lot of women want to come to work to escape what's going on at home, in a lot of cases. But actually, what they don't want is more pressure, more spotlighting, and you know, having to do something because someone else is suggesting it. So I agree with you. It's very complex to unpick. So I mean, how do we unpick it and make it a different experience for people? Because actually we should encourage people to provide mechanisms so that they can educate themselves, so they can get the supports that they need, even if they don't want to turn up to all the meetings and events, etc., etc., etc. So what would be a better way around this, would you say?
You're absolutely right there. So I really feel that, yes, I mean, there's a lot of talk around the workplace taking the responsibility to educate, inform people, raise awareness within the workplace around that transition. But that is good, but just like you said, there needs to be some proven, robust approaches that women can take on themselves and own for themselves. This is what I can do to help myself, rather than showing up to work and expecting my employer to do it. Yes, my employer have maybe done some raising awareness, maybe we have a policy in place, we have some guidance. Leaders, you can come and talk to me about it and feel comfortable and have a really open, honest conversation. But what's missing? How does she really take care of herself? Does she have the tools? What can you do as an organization to enable her to have those tools? Not
Yeah.
just take HRT, it has to be something else.
Yeah, no, exactly. It's like mental health. Okay. We talk about a continuum in mental health. We have good health and we have times where we're struggling with our mental health, but we ebb and flow along that continuum. And I personally believe, having done 15 years, and you may be the same, Pamela, I'd love to know your thoughts. You've got to be agile, because we don't know what next week's going to be like, or next month's round of symptoms. We might get a good month. It might be a worse month than this month. So your agility and your ability to advocate for yourself and to feel empowered that, yep, I've got a range of choices here and I'm going with these choices for now. That's what we should be offering. And I use the word offering deliberately, offering to people choice, isn't it?
Absolutely, choice. And for myself, I think, because I was really poorly with chronic fatigue syndrome from the age of 46. So I don't really know when my perimenopause started, really. I think around about the same age. So I'm probably like 12 years
Yeah.
into it at this point. But because I had chronic fatigue syndrome, which was a virus, the Epstein-Barr virus, there's a
Yes.
awesome wine,
Yeah.
chronic fatigue. And, I feel very, very fortunate. I pinch myself every day, because I've gone from being really sick to being really healthy. And so my transition into menopause has been really easy. It's been, I started having really dreadful hot flushes and night sweats when my mum passed away, and I remember being so this is 2020, and obviously we'd only had lockdown.
Mm.
And my brother-in-law passed away the same year as well, in August of the
Oh.
year. So, it was a really stressful time, and hot flushes and night sweats, and it was just absolutely awful. And I remember thinking, this needs to go.
Yes.
Yeah, I can't cope with this, like sleeping at night and the bed being completely drenched. And even at the time, I didn't really put it down to, these other added stresses that my body's having to cope with. And so as now, looking back, I didn't really put the pieces together myself, but I did do slowly over time, thought, right, okay, this is what I need to do. This is in my toolbox. I need to do more of this. And yes, they dissipated, they've gone.
Yeah, and that's amazing. So in summary, I guess what we're saying to people, if you could pick three things as a roadmap or signposts along that roadmap for people, what would be the three things that you would say to people? And we're specifically saying, if you are a person of color, if you have Asian, if you're someone from an Asian community, if you're someone from Black community, if you're someone like myself who's got feet in multiple camps, what generally would be helpful advice to people or signposts?
Yeah, I think GP, that is kind of the number one thing, really, because of the medical gaslighting that I hear from clients, is to first, like, be well informed. So educate yourself about your body, what you should feel like, even if you've tried something, what else could be happening, particularly if you're on HRT and you're just being prescribed more and more HRT as a solution. You have to go broader, you have to go wider. What else could be contributing to that? What can you leverage with your GP? Ask for the right tests. So these are the things that I empower my clients. What else could be happening? And then, educate yourself around what is optimal levels, not just often you get you know, a message from the receptionist saying to you, you know, your GP said no further action. But then when you look at the blood reports, you're literally almost depleted of
Yeah.
certain like iron, for example. So get a printout of those and look for yourself. So become your own health advocate. Is really, really important. The next thing is to build a community, so around you, a supportive network, whether it is women that look like you, speak like you, maybe going through the same thing, whatever, but build a community of support around you. And then within that support network, not just females, but also the men in your life as well. You need to bring those along with you, and children too. Particularly if you have young children, or even if you have young, you know, women like
Teenagers. Yeah.
my 32. So, you
Yeah.
know, even they need to understand. So bring that community, a web of support with you. Really, really important, because it can be really isolating at this time as well.
Yeah.
Yes, the third one would be so whilst you're kind of educating yourself, knowing your body more, listening out for signs, speaking to your GP, asking the right questions, getting the right results, you know, creating a web of support. I guess the last thing would be to really get in touch. And particularly, I often hear women say, you know, particularly in the perimenopause, and they go, oh, I've had oops, sorry.
All right.
Mind on my phone. Had another period. And I go, oh, I've had another period. You know, I'm not there yet. I'm like, no, you
That's
need to,
great.
yeah, you need to hold on to your
Yeah.
hormones.
Your body's doing what it's meant to do. This is a reason to celebrate.
Exactly. Like, oh, I can't wait to get to that year. No, no, no,
No.
no, no, not at all. This is your opportunity now to like really put some great practice in self-care. I call it radical self-care,
Love
you
it.
know. Yeah, because it is radical, you know, like going outside, exposing to your eyes to natural light, you know, as early as possible. Sitting and chewing your food really well, asking for help, you know, seeking out what's holding you back. You know, we talked about limited beliefs. Often women don't ask for help. This is fear. Like, where did that come from? So yes, so really embrace your bodies. Don't believe this narrative that your period is bad, your period is good. So when it comes, this is now your opportunity to learn more about yourself, learn more about your unique body and your journey. Because once you hit the menopause, life is very different. Your body is different as a result of that. So the more we can do prior to that point, the better.
Absolutely. And I love that. And I feel that that's what I missed out on, because we didn't have that education, because we didn't have that awareness. You know, I'm a kid of the 70s. You know, social media is relatively new, as is the internet, and having the wherewithal to try and, I mean, I did spend a decade connecting my own dots, and I think it makes me a more informed coach. I'm of better service to women because I know what I'm looking for, and the only thing I can't do is prescribe, but everything else I'm able to help you connect the dots. And Pamela will be exactly the same, and at a different level, looking at that functional side of things. But yeah, embrace your body. And I do love, bring another culture in, you know, very much the Chinese culture of, you know, that second spring for you, you know, in Japan as well, that actually you're about to come into your greatness. So why not take that opportunity to get really clear on who you are? You know, that starts here. That, like we always say, this is an integrated system. So, you know, if there's stuff showing up in the body, it's probably manifesting either here and in our second brain, which is our gut. So we need to integrate all of it, don't we? So we can't just expect it to show up for us every day. Like anything that's a classic, we need to put a bit of love, care, and attention into it. So the last thing I need to ask you is, how can people access you, Pamela? Because I bet loads of people are like, oh my gosh, I so need to see Pamela. She's already incredibly busy, but you know, she does amazing retreats things. So tell people the sorts of things you can offer, how they can engage with you, and give us your socials whilst you're here.
Yeah, so you could just, you know, I don't know, follow me on social media as a start. You can send me an email, you know, and we can arrange to have a consultation. I do a 30-minute complimentary consultation, and we take it from there, really, how you want to work with me. You know, yeah, in terms of working with one-to-one, that integrated program that I offer, and then whether you're more suitable for one of my smaller courses as well, or whether if you work for an organization that you've actually done all these things, you've got the policies in place and you've got line managers are already geared up and knowledgeable about it, but you then want to improve the life for other women in the workplace who struggle with endometriosis, PCOS, fibroids, and those other health conditions, and you want some actual resources that women can lean on to navigate their health journey as well.
Amazing. So do you see people only over Zoom or in person? How do you see people?
So mainly over Zoom nowadays,
Yeah,
since
amazing.
2020.
I'm the same. And actually I think that's a good boundary for myself as well. I'm sure you would agree for you too. So that makes it more accessible for people. They can fit it in to what it probably is quite a busy time in their lives. If you've got elderly parents, if you've got children, financial pressures and all of these sorts of things, it really, really does work. So what's your handle on social media?
So on Instagram, I'm Pamela Windle, women's
Yes.
health coach. And then LinkedIn, I'm Pamela Ann Windle.
Yeah, you are. That's why I asked you right at the beginning, but I'll put all your details on the notes under this episode, Pamela. So we'll link people up with you. And do you have a website?
Yeah, so my website is Smarter Change, but if you put Pamela Windle into Google, it will come up with that as well.
Yeah, it's a great name. Smarter Change. What's at the end of that?
.co.uk.
.co.uk, which is brilliant. So that is amazing. Very last thing, infinite wisdom, which you always give me, and I always make lots of notes, as I've done today, whenever we chat offline, online, in an interview. What's your one hope for women going forward? If we look back over our shoulders in 5 years, when we're next at whatever meeting we're at, and I'll go, did we do it, Pamela? Did we do it? What's your hope for the next 5 years when you think about people navigating menopause?
Oh, wow. 5 years. I mean, gosh, we've done 8 years already.
And I'll make it a little bit more specific. Let's talk about for Black women and Asian women. What's your hope for them?
Yeah. So I really hope that Black women and Asian women really start joining the conversation, that there's more, when we're having these big meetings or events, that it is more diverse. Yeah. So we see more color in the room. That would be amazing. More color and more men in the room too. So that would be good at that next event in 5 years' time, that we're in that room and it is multicultural and also multi-gender as well.
Well, we'll be the hosts on the stage, right? So we'll make it happen. Look, she's already like clapping. The amount of people that said to me on Tuesday, we were at that meeting, we just need more representation. And so we're colourful people. And actually we've got a great message. We want to collaborate and bring people with us. We don't want to be waiting. We want good clinical evidence. We want to be part of the conversation. And like you brilliantly said, we want men as part of that solution too. So Pamela Windle, I think we've sorted everything out now in one episode. The world is a better place. So thank you so much for your time, and I'm sure we'll have another conversation.